Hi, welcome to our Digital Voices webinar. Today, we're going to be talking patient centricity in a digital age with Dr. John Whyte. So just as a reminder for everyone, we are live and we do live for two reasons. The first is so you can interact with us. So it's a great opportunity to interact, ask questions. We typically have 8 questions or so at each of these webinars. We'll get to as many as possible, so you can just enter them in and I will moderate those and get into. In fact, we've already had one submitted, which we will answer on air. And the second is, it just makes it kind of fun because you never know what's going to happen. And so far, so good, though. We've had really good experiences. So I'm really excited on this topic because it's at the heart of what we all do. It's really all about the patient. We love our clinicians, and we do a lot for the clinicians as well when we talk about digital and technology. But at the end of the day, it's all about patient care, and that's why we're all in this. And so thrilled today to introduce you to Dr. John Whyte. I will let him primarily introduce himself and share his journey, but just some quick highlights. One, he's an author, so I love this book. Thank you, John. This is this normal? It's like for people my age, like as I'm aging, it's really practical. I love the book. And he's a blogger. I read John on Medium as one location for some of the things that you write about, John. And then obviously he's a physician, a practicing physician, a family man, has received education from Duke, Harvard, Stanford, all the amazing institutions, and just a great person, as you'll get to know. So John, thank you for joining us.
Thank you for having me, Ed. It's nice to see you again.
Yeah, great seeing you. We did a podcast together, which we're going to release after the webinar, and it was really good. So if you enjoy the webinar, you'll like the podcast as well. So I gave kind of a high level, who's John Whyte? But John, you've got this amazing experience, life journey. Can you share a little bit about yourself and your journey and how you got to where you are today?
Yeah, and thank you for those kind words. I've always been interested in medicine, and I initially thought I would be, as I told you, a surgeon. And then I realized I really was interested in some of these other policy issues about how do you impact the healthcare system. That's hard to do as a surgeon. And then I thought I'd be a chair of a department, of medicine or a dean. And then I realized, oh, hey, I really didn't want to do that. But the key element was I was always interested in communicating to people. How do I communicate to that patient in front of me to adapt healthy lifestyle changes? Because I wanted to follow patients on their journey as well and be that primary care physician. But then how do you also do it for populations of people? And when you look at my career, people are like, sometimes they're like, oh, it doesn't seem to make sense. But in many ways, it does, because I've been in and out of government in these policy roles at Medicare, at CMS, and FDA. And then in between, it's always been in between. I've been in these, very public-facing media roles at Discovery Channel, where I actually created health programming, and now at WebMD, one of the largest brands in health, trying to give people the best information that they can, because whether it's the person in front of you or it's a population of people, I know that better information is going to lead them to a better life. And that's really my goal.
No, that's great. And, people like myself would think, oh, wow, like Discovery Channel. So right before we jump into patient centricity, one key thing that you learned from that experience that you might utilize today.
Yeah, Discovery Channel, people are always felt that was cool and all of my jobs, and it was a great place, and I spent nearly a decade there. And what I learned, Ed, was the power of storytelling. And I think as physicians, sometimes as senior executives, we're so focused on data. We're so focused on Excel spreadsheets, and we don't recognize the power of storytelling. And that's really what Discovery Channel taught me. And it also taught me that you had to get people's attention. You can have the best information out there, and you shouldn't assume that people are going to listen, because they don't, because they have a lot of other options. So I had to educate people, but I also had to entertain. And I had to recognize, and it's the same thing that I learned, with patients. You can't throw too much at them. You can't ask them to change 10 different things. In a story on diabetes, I can't give them all the facts and 20 different teaching points. I tried, and those shows were very bad. Didn't do well. So I quickly learned compelling stories, compelling characters, and then include some information there too that can help them change their lives. And that has helped me in all aspects of my career, that knowledge of the power of storytelling.
No, that's excellent. Thanks for sharing that. So let's jump in. What is patient centricity or patient centricity principle?
Yeah, and I really have been interested in that, for the last 5 years or so, particularly starting at my time at the Food and Drug Administration, where we focused on this idea of patient-focused drug development. And we have lots of different terms, but what it really is about, the patient should be at the center of the healthcare system. And shockingly, they're not. I think COVID is changing that, but and I say this as a physician, it's always been focused on the physician. What's going to keep the physicians happy? How do we educate physicians? How do we do physician parking? Which is always a sore point. Everything has been, the physician has been in power and controlled everything. And then the patient, who's the recipient of our care and the recipient of services and needs the services, is kind of down here. It might be mirrored on Zoom, but we really need to have shared decision making. We really need to make them equal partners. And I think COVID has accelerated the changes that we started to see, where it is about the patient experience. It is about connectivity. It is about control. Who controls my data? Who controls whether or not I go see this provider or not? It is about convenience. No one is going to want to drive 30 minutes anymore or take the subway for an appointment, wait another 30 minutes to be seen for a 10-minute appointment, and then your whole morning is gone. That just is not helpful to patients. And that's the difference. That was focused on the doctor's schedule. Well, now we have to focus it on the patient schedule and give them that convenience and control. And yes, also cost as well, how that plays a factor in it. So it's really this idea of the patient's really in the center. And even when we talk about, drug issues, I only point it out because the issue is patients are experts in their own diseases. So we should be measuring outcomes that are clinically meaningful to patients. And that's really a paradigm shift because it's always been, as you know, medicine is so hierarchical and is so paternalistic, like I know best. There used to be a measure of how the patient is doing in a lot of clinical trial reports. The physician would rate it. They've changed it now at FDA. But isn't that great? I will tell you, Ed, how you're doing. Okay. Right. And write it down. But that's the mindset. That's crazy when you think about it. So it's really that the focus is on the patient. The patient is at the center of everything. And let's be honest, we haven't been there. We just have not.
Yeah, I agree with you, and I want to share a quick flashback I just had, and then push on the point that you're making, because I think it's going to even further focus the conversations. But I had a flashback. My first salary job in healthcare was physician relations coordinator, and my job was nothing except to make physicians happy. Yeah. And so, John, I really was. You mentioned parking. That's why I had this flashback. So the physicians were complaining about the parking lot that their cars got hot in the summertime. So I was empowered to plant trees, in the parking lot. And that was the focus, of the healthcare system at that time, was strictly the physician and nothing about the patient. Obviously, things have changed over time. But let me push on your point a little bit, because actually when we spoke previously, it actually pushed on me a little bit. I thought, oh yeah, John's absolutely right. So, and it kind of correlates to a question that we already had come in. So I thought to myself, when I heard about patient centricity, I'm like, oh, I'm all about that. That's really hopefully a hallmark of some of the work that I've done with my teams in various organizations, is becoming very patient focused. So I talked about, hey, I include patients in let's say design of a digital front door, or included patients in the design of a new hospital. But it's much more than that, right?
Absolutely.
Yeah. That's kind of surface. It's a good step, I think, towards what you're talking about, but it's not the end.
That's exactly right. And it's not just asking about patients how they feel or what's important to them. And, it's kind of like even, in the government where it's evolved where you put a patient on the panel, right? So that's including patients. It's not. It's
Right.
even, in healthcare, you bring a patient in and they're going to hear their story. Okay, you should have been doing that 10 years ago.
Yeah.
What we need to be doing now is bringing science to patient centricity and understanding as a population based on certain demographics, sex, race, age, ethnicity, socioeconomic status, maybe even geography by zip code of what's important to patients. How do they respond to certain elements? Variability of drug response based on certain factors. What consumers, patients want in terms of digital health tools and how they're going to use it, and bring a science to understanding patients and not finding one or two patients that you're going to talk to. That's not what I mean by patient input and patient centricity, but that's the default. I think
Yeah.
part of it is, Ed, to be honest, that people don't know what it means. They don't know how to do it. How do I go talk to patients? How do I go find patients? How do I do this? But there's a science, and in many ways, that's the social sciences of how we assess and analyze attitudes, beliefs, opinions, needs. We're predicated in medicine and health on a biologic science in terms of p-values and rigorous type of scientific lab studies, and there's a disconnect
Yeah.
in terms of how you do it.
Yeah. Thanks for that clarification, John, otherwise there's a lot of people like myself who feel like we're fairly progressive in terms of doing some of the basic things, but that's what they are today is basic. And to get to this really true patient centricity, we have to take that level that you're talking about. So we're going to jump into our first audience question, but I just wanted to remind everyone, we're actually halfway through the webinar already. So if you do have questions, if there's something that sparks your interest around patient centricity, and you want to talk to one of the world's foremost experts with this amazing background, Dr. John Whyte, please go ahead and enter your questions. So the first question from the audience came in a couple days ago. How can we best represent the patient voice in internal hospital meetings on digital health transformation? So almost some of the things that we were touching at a high level. So how can we best represent the patient voice in internal hospital meetings on digital health transformation?
Right. I think you do that by assessing patients' opinions and input, and you have to do that by some type of survey instrument, whether it's a online quiz, whether it's a systematic way of calling or emailing patients in a scientific manner, perhaps a random interception of people that have interacted with the healthcare system. It's almost like in some ways the way that a lot of people do customer service well, but it's more than that. And hospitals have done that before. And then they're somewhat dismissive. They'll be like, oh, patients always complain about the cafeteria food. Well, that's because it's the questions that you're asking. And it really is developing those sophisticated survey tools that we use in other areas of the economy to assess what patients need. So, for instance, as you talk about healthcare systems, part of the issue in many areas of the country has been access to dermatology appointments. People have a lesion, they don't want to wait 6, 8 weeks for an appointment. That's what it is in many areas, maybe even more. So, what are they going to do? They're going to download an app, they're going to spend $40 of their own for a quick read of a mole. And there's many services that offer that. Is that the best care we're offering as a health system? If a patient came into me, I'm going to feel for other lesions around their body, perhaps if they have lymph nodes somewhere. I'm going to look for what's called satellite lesions. Everyone's not good at taking a good picture too. I'm just going to tell you on some of these apps, and it matters because distance of the camera from the lesion can impact what it looks like in terms of size. But I point that out, Ed, because they're not concerned about the cafeteria food. They're concerned about how do they get an appointment. Like those aren't things that we're addressing. We are talking to them about how we're going to bring back that information. to the health system, how I can help you manage your care better, how you'll come to me to help you. That we can't let them say, well, they'll have patient centricity on their
Right.
own time, right? And do it on the digital. If you're unhappy with waiting an appointment, go download an app. That doesn't help anyone. And you know what? If you're not starting to have that mindset, competitors will, and they'll go elsewhere.
No, that's really great insights. We have a lot more questions coming in. So we are off script because this is about, speaking of patient centricity, we're about customer centricity, and that's what this time with you is all about. So let me hit a couple of these questions. How are families? So we've talked about patient centricity, and I know that incorporates, I believe in your response, probably incorporates families, but how are families brought into the patient-centric equation in the case of when they're they're an aged patient and I can't even pronounce the word, John.
Incapacitated?
Yes,
Yeah.
thank you. Oh.
They're almost never incorporated in a good way. And that's partly because, we encourage patients to talk to their family members about their wishes and needs, but most people don't, because no one wants to talk about how they might be incapacitated one day or how they get old. And let's be honest, it's not just about dementia. It's also about people that are involved in car accidents and other injuries that have, significant impact on their ability to function. So it's important to know what they are. But in many ways, the family is the best resource to be brought into those decisions. And too often they're not. We're also not good at talking to family members as well about issues, either as family members or physicians in the healthcare system. So we really need to have more of that dialogue and encourage that. Um, so that's something that we need to be doing. I often find when I still see patients, when a patient brings a family member, it's usually a better interaction, because then there's another set of ears. I joke about that someone else can be listening. Sometimes that other person gives me better information in terms of what's really going on. It's usually the wife, with the husband telling me what's really going on. But the whole point is that gives better care. So it's not, you have a great point. It's not just about that individual patient, but about the family as well.
Yeah. No, I can relate. When I was going through successful cancer treatment, if I didn't have my wife there as an extra pair of ears, I wouldn't have been as far along as I was able to go. So a lot of other questions. So another question that came in, John, is, are there industries or companies outside of healthcare that you think do, obviously it won't be patient centricity, but certainly consumer centricity? Well, like what sort of companies have you interacted with that you thought, oh, if we could bring that to healthcare?
Yeah, I think Walmart is a great example of a company that focuses on customer satisfaction and the customer experience, in terms of, whether you want to joke it's a greeter, when you come in, or if you've ever had to interact with the customer service department and returning items. It's very much a positive experience, even how they design and lay out their store. And what's interesting, it's funny, you said it doesn't have to be about healthcare. If I asked you 5 years ago, would you go to Walmart for your healthcare? You might be like, what? Are you crazy? Well, Walmart is building clinics or building centers, particularly in those areas where they have very good reputations and very good customer service. They're an important part of the community. That's an important element too. Now, if I ask you, you might say, John, I prefer to go to Walmart. I can get my vision care, my dental care, my pet care, imaging, and buy toilet paper, all in one stop. But my point, Ed, is they're responding to what patients need. They're responding to the experience. I mean, all too often we know, go to the front desk of the hospital or the clinic, and I get it. People there have tough jobs, right? They're not necessarily the most friendly and collaborative and collegial, and that creates a challenge too. And often in doctor reviews, you hear the front staff was rude, or someone else was mean to me, the security guard, whatever. Walmart is very good about that in terms of providing service. I mean, Amazon is very good about the experience that you have online, right? That's what's important too. And I point that out because both of them are interested in the user, right? That's what they're focused on, right? So you could say they're user-centric.
Right.
That's what we have to get to healthcare. It's not patient-centric. Go to a hospital website. They're some of the worst healthcare. They're like in the 90s still.
Yeah.
And you don't see that in a Walmart, in an Amazon, obviously, and others. So those are just two that I think can serve as role models. So how do we do this well, this patient centricity in a digital age?
Yeah, those are really good examples. And it just made me think, John, about how this needs to become a strategic differentiator. It may not be even a differentiator. It may be just keeping up with some of the competition. So if you were suddenly hired as the chief digital officer or chief transformation officer or CIO, whatever the role might be in that particular organization, what are some things that you might recommend on average? We all know that there's some health systems are more advanced than others, but on average, what, like you mentioned the website, like, a complete redo, rethinking.
Oh yeah, yeah. That's a given. That's a
Yeah.
given for most folks. I mean, they don't have good information. What I'd want to understand, I would do first a comprehensive survey of the attitudes and beliefs about the system in the community and the needs of the people in the community. And if they don't come to that system, why they choose to go to others. But I'd also recognize this push towards do-it-yourself medicine. This idea that we have all these digital tools that we can use at home to manage our own healthcare data. We all got Fitbits and Apple Watches going on. There's so many wearables, trackers, and sensors. I'd figure out a way, how do I use all this unstructured data that you have, right? Make it structured and bring it into the healthcare system. So you know what? If your Fitbit, your bed, your pajamas are telling you about sleep apnea or other things, I'm going to make it easy for you. I'm going to encourage you to come in and bring me all that information so I can give you a better healthcare experience that you don't need to try to manage it on your own. I'm going to be the place for everything that you need. And if I can't do it in person, I'm going to do it telehealth, telemedicine, but it's going to be more. Just as we saw with COVID, I can give you a pulse ox. I can give you other devices. So it's not just simply a video visit. Sometimes it is when I talk to patients and trying to figure out, I can have more digital tools. And I'm going to make the digital tools an extension of my provider community rather than your digital tools are yours, Ed, and you just do with them what you want, and maybe you'll tell me about it, and maybe you won't. But right, I could use all that data that you're collecting to give you better care in a shared decision-making model. So you're not going to get mad that you can't see a dermatologist for 4 weeks. I'm going to find other ways to do it with apps and other things and make sure you get the best care that you need. And that's how I'm going to market it and advertise it and actually provide the outcomes to do that. Because the old model is the physician, right? You got to come in, got to see the physician. They're in charge. Do an app, they're not going to like that. But now I'm tying it back into the system. That's what I think is going to help.
No, that's great insight, and that covers a couple of the other questions that had come in, some related to COVID and others. So how would you, so I talked about how, I asked a question, I was setting up a question about strategic differentiation. And then I sort of modified that to say, look, it's not strategic differentiation anymore, you just have to do it. But let's just say that in some scenarios, just within healthcare and not thinking about the new entrants like Walmart, how else one, just to validate, do you think it would be a strategic differentiator today when you compare hospitals to hospitals? And if you found yourself behind the curveball, we already talked about a couple things to do, but what would be some of the guardrails that you might think about, when you look for opportunities to improve your patient centricity?
Yeah, I do think it's a differentiator because health systems don't typically think like this. Even think about their marketing. We joked about it. It's still this old school. I get a gazillion postcards still
Right.
from hospitals that, some new doctors there, they have a new, prostate surgery issue or something, they have ads on TV and in newspapers. I'm not sure those technologies and strategies work. And the reason why I say that is because I know people search health online. 80% of search on Google, is often health related. So people are online searching. So I should go and look at it and be advertising there. That 80%, I'm phrasing it the wrong way, but enormous amount of search on Google is for health. So I want to be online, first of all, there. But I also want to make sure that I am protecting patient privacy in terms of guardrails. You also have to be sensitive to what's just the reality, the reimbursement mechanism and the payment structures. The reason why telehealth has worked during the pandemic is we had payment parity. So that mattered. So, those are some of the issues that we have to recognize. And also the culture of respective institutions takes time to change, and you just can't bulldoze your way as well, despite how important it is. So that's an important element as well.
Yeah, John, this has been fascinating. We got some really good feedback online already as well. So in our last minute, some of my friends, some of the audience are from payer and life sciences. And anything different, that might be specific to the payer, thinking about from a member experience, or from life sciences for clinical trials or anything like that?
Well, I certainly think all of this helps in clinical trials in terms of democratizing clinical trials. I think COVID has created, some opportunities to make clinical trials easier and more diverse. So I think that helps a lot in terms of the changes that we're going to see. And then, in other areas, it's really about, how do we focus on outcomes too? Right? Because that's what matters. How do we know that these are going to have an impact? And we have to measure that. And I think that's an important element as well. We want to do these things to improve outcomes. And that's what patients are going to respond to. That's what we all care about, as well.
Yeah, this has been an amazing conversation. I could go on for hours, John, if we had time and everyone had time. I have so many more questions in my mind, and we only got to about half the questions that were laid out. But I just wanted to thank you on behalf of the audience. Thank you for joining us and being part of our webinar.
Absolutely. Delighted to be part of it.
All right. Well, thanks everyone for joining us. Just a reminder, we have some upcoming webinars, another one from a CFO perspective. Those are always interesting just to hear from the finance. I always say you need to make finance your best friend wherever you are. And then, of course, we have a weekly podcast that drop on Wednesdays. And you'll hear Dr. John Whyte. If you loved the webinar as much as I did, you'll be excited, I think, to hear him again on our podcast coming up. So just check on your favorite streaming platform for information on that. So thank you again, and have a great rest of the day.
Thank you.
Yeah.